Our Black innovator was Danielle Williams. Danielle Williams was born in Hollidaysburg, Pennsylvania, but when his father died, he was sent to live in Baltimore, Maryland. There he became a shoemaker's apprentice, but disliked this work. Later he became a barber, but also disliked this work, and decided he wanted to focus on his education. So he worked as an apprentice with Dr. Henry Palmer, a surgeon, then completed training at Chicago Medical College. In 1898, he married Alice Johnson and moved back to Chicago to work at Provident Hospital. In 1926, he had a stroke and died 5 years later in 1931 in Michigan. He set up his own practice in Chicago's South Side and taught anatomy at his alma mater. In 1893, Williams continued to make history when he operated on James Cornish, a man with a severe stab wound to his chest who was brought to Provident. Without the benefits of a blood transfusion or modern surgical procedures, Williams successfully sutured Cornish's pericardium, thus becoming one of the first people to perform open heart surgery. Cornish lived for many years after the operation. In 1894, Williams moved to Washington, D.C. and became chief surgeon of the Freedmen's Hospital. There he provided care for formerly enslaved African Americans. In 1895, he co-founded the National Medical Association. Due to the discrimination of the day, African American citizens were still barred from being admitted to hospitals, and Black doctors were refused staff positions. As a response, Williams opened Provident Hospital and training school for nurses, the nation's first hospital with a nursing and intern program that had racially integrated staff. Danielle Williams should be remembered because he started the change for allowing Blacks to be hired in the medical field. He was also a prominent African American figure who performed one of the first open heart surgeries and paved the way for racially mixed doctors in hospitals.